Now, let's get to the signs of where the treatment starts, the stages of treatment options. So, I do understand that there are unorganized treatment options. So, what should they be aware of before they start to seek help?
Here, I would like to take it from what we are doing at Cadabams. I think that would be much more relevant. Plus, also, I feel the services that we have is the most comprehensive one, because we are managing a person who has started taking alcohol, or who is in the very, very early stages of alcohol problem, to a person who has a deep-seated problem of alcohol dependence syndrome with series of relapses, or whom medically we call it as a chronic alcohol problem. Though it comes under alcohol use disorder problems. It's a severe problem. We are able to cater to the end, from this end to the other end of the spectrum. When somebody is taking alcohol, as I said, from a user to an abuse or a harmful use to a dependent user, the model of care that we have, or at Cadabams we are having, it's biopsychosocial. All the three domains are equally given importance at every stage, and we have professionals who are addressing this biopsychosocial issues of an individual. The first is the biological part of it. When we say biological part of it, we are looking at the physical domain. That is, why is this person getting into this alcohol problems, and how can we help biologically with medicines, with diagnosis of any associated psychiatric issues which might be contributing for this individual to get into the alcoholism or alcohol use. That is taken care. That's the biological part of it. Second one is the psychological part of it, where we try and understand the personality of this individual. If the way he is coping up with his day-to-day stressors or life situations by compensating with alcohol. If so, how do we deal with it? That's the psychological, the part of it domain, which is taken care by the clinical psychologist. The social domain, be it his occupation, his friend circle, the interpersonal issues, or the family issues that he has, all those things are dealt by the family therapists or psychiatric social workers. Coming back to the different stages or different services that is necessary for these people who are going through alcohol problems. First is this that they have to get admitted to a residential or a de-addiction center, which is the most commonly understood or spoken thing, that if there is an alcohol problem, they have to be put into de-addiction center. No, the answer
Doctor, just to stop you there, probably at a stage where, when we say that there is a medical, there is a psychological aspect, a social aspect, would there we do give clarity to the individual who's seeking help, and we do give clarity to the immediate family members who come to seek help. So what should they come with as a mindset, or is there, as a professional, you expect that the family member and the recovering individual to come with? Is there a role that they play when they start off, or even explore that this is when they want to go in for the treatment?
Okay. First thing, the people who are having the problem, one, they do not know that they have got the problem.
Sure.
That itself is one of the major issues, which is the challenge that both professionals as well as the family members have. So
making sure you go to a qualified mental health professional is probably the first step.
Most often not, it is the family members who recognize the problem, and it is they who seek or who approach the mental health professionals, be it psychiatrists or counselors or clinical psychologists, for the treatment options. And when they approach, of course, without the person who is into the problem, him or her being involved in the whole process, there is no way out. How do we involve him is the question, And for that, there are professionals and organizations like us.
Interesting.